1 in 4 adults has a diagnosable mental illness. This impacts families and our entire society.
People with the most severe and persistent mental illnesses live their lives with stigma, shame, social isolation, poverty, and premature death.
Without support, many mentally ill people end up homeless because they can't care for themselves, let alone hold a job.
A large number of people with a mental illness are incarcerated in Washington because they displayed the symptoms of their untreated mental illness.
Our jails are filling up with people who suffer from mental illness. The psychiatric unit of the King County Jail is the only population in our jail that continues to climb at a faster rate than any other population.
People who are homeless are twice as likely to be incarcerated, but by criminalizing mentally ill adults, we are exacerbating their condition. A criminal record makes it harder for individuals to ever find adequate housing or employment.
Once a person with mental illness ends up in the criminal justice system, it's a little bit like a runaway train in a very bad way. We cut off their lifeline and we make it very difficult for them to ever get the support and services they need. The problem is not getting better. We treat mental illness in an emergency room fashion. We're doing it the most expensive, least effective way.
There are nearly 500,000 residents in Washington with a severe mental illness.
These are people who live in our community and they deserve better.
About 20% of American children suffer from a diagnosable mental illness during a given year, and nearly 5 million American children suffer from a serious mental illness, one that significantly interferes with their day-to-day life.
The grade we would get for dealing with people with mental illness is clearly a failing grade right now. I think one of the challenges for people with mental illness is that they have to deal with their illness in silence. And they often will push people away who are trying to help them because they misinterpret what the person's intentions are. Sometimes these people that are trying to help them is the only thing that's between them and becoming homeless.
I think one of the things we do in our community often is focus on the symptoms rather than the core reasons for the behavior. Mental illness is so complex and it affects so many different arenas of someone's life. You can't fix mental illness with just one thing.
There are lots of things one needs to remain healthy. Not just primary health care, not just behavioral health care, or assistance with chemical abuse and dependency, but also safe, decent, and affordable housing. We have people living today in the community, a much better quality of life, a much less expensive form of treatment, and indeed people who are getting jobs and getting better.
70 to 90% of people who have received treatment and support for mental illness report a decrease in symptoms and improved quality of life.
When a person with mental illness is treated well, some of those things in their lives that have crumbled can be rebuilt.
Recovery is possible.
People can get better.
Navos is part of the solution.
Navos es parte de la solución.
What we do is help remind them who they have been in their very best times and help them find a way to be an even better version of that in the future.
Our programs are integrated, innovative, and effective. We treat the whole person, creating a sustainable foundation for success, stability, and quality of life.
Organizations like Navos, not only are they operating effectively, but they're smart. They're taking scarce dollars and getting the very most out of them.
Having all the services under one roof is very helpful in any situation, but it's really critical in the population that we're providing care for here.
People get better much more quickly when we're focusing on their strengths and when we're partnering with them to operate from their strengths. Our new Mental Health and Wellness Center is all about a safety net that will, in a very efficient way, address the needs of our clients.
We are the only program in King County that offers the full continuum of mental health services.
Innovative outpatient therapy that treats the person, not the diagnosis.
Therapeutic programs for abused and neglected children and their families.
Employment services that encourage self-sufficiency.
Inpatient psychiatric services help stabilize adults in crisis and create a plan for the future.
Integration of primary care with mental health.
Infant mental health for at-risk infants, young children, and their families.
Safe and affordable community housing.
Peer support training programs for lasting change.
We can all help.
We can all make a difference.